Hi, I'm Alison Kennedy, CEO of the Toowoomba Hospital Foundation, and I'm here with Mike Horan, who is the Darling Downs Health Board. Welcome, Mike.
Yeah, thanks Alison, nice to be here.
Mike has an incredible connection to Toowoomba and the Darling Downs through his previous political career and has supported the foundation in various roles since our establishment. We're very fortunate to have Mike as a member of our board. Thanks for joining us. We just want to have a little chat to you about various things. Can you tell us about your journey to become the chair of the board of the Darling Downs Health?
Yeah, thanks Alison. Well, it's been a longish journey. I suppose I came to Toowoomba in 1978 to be the general manager of the Toowoomba Royal Show, and that really immersed me in the community. We ran the show at the old showgrounds, and we went through a process that took a few years of eventually selling the showgrounds there and developing the new showgrounds at Glenvale on 250 acres. So I was totally immersed in the community in one way or another, either with the show, or we ran up to 180 events a year at the new showgrounds, including greyhound racing and home shows, motor shows, rock and roll, horse and dog shows, and weddings and functions. So it's really part of the community, and loved it. Loved the city, and I loved the community of the Darling Downs. And that led in 1991, I was fortunate enough to win the seat of Toowoomba South in a by-election for the National Party. And went into Parliament, had 21 years in Parliament, and in that time I was Leader of the Opposition, but I was also Minister for Health for a term, which I absolutely loved it. And people often said to me, were you a doctor? And I said, no, I was a footballer, a dairy farmer and a showgrounds manager. But I think it gave me a background of understanding what people wanted and understanding what our staff wanted in health, and I absolutely loved the term that I had as Minister for Health, and we were able to achieve a lot throughout Queensland. So that was sort of my journey. So I retired after 21 years in 2012 and was appointed by the then government as the chair of the Darling Downs Hospital Health Board, and that was the beginning of boards as such. They came about as a result of a major change to health in Australia that started with the federal government in 2009, and one of the recommendations was that there should be local management of health. And Queensland went ahead and fully put in place some 16 health boards throughout the state. Which
has been an absolute journey, and obviously a fantastic result, having those boards and the local boards, because it's having that local knowledge is just so important.
It is, Alison, and there's been occasions where we've made decisions that are really based on understanding the local community. So we've got 20 hospitals, 6 nursing homes and a number of other facilities throughout the vast region, going as far west as Goondiwindi and Toowoomba and all the South Burnett and Toowoomba and the Darling Downs. So there's been occasions where the government or Queensland Health may have wanted to close something down or sell something off, and we've said no, that local community needs it, and we've kept them. And a good example of that was keeping the 6 major nursing homes that we have spread throughout the area, although they're difficult to run and financially a drain on us, but they're needed in each community, and that was local knowledge of our board members that brought that about.
Which is fantastic. You mentioned your previous role as Health Minister. You contributed a lot to the early establishment of the foundation. What's it been like seeing us grow and change over the years?
Oh, it's been wonderful. When the foundation started, it was always well regarded, and the people on the board were well regarded, and they were doing it for their town and their community. But it's been good to see the growth that's occurred. And I think when I was Health Minister, because I understood how difficult it was for a foundation to, first of all, raise the money to pay their own wages, let alone start to put money into the hospital. When we built 5 new parking stations throughout Queensland at 5 separate hospitals, multi-storey parking stations, I enabled those to go to the foundation in each town, and that provided a financial base for the foundation, so they could really concentrate on raising money and doing the things that they do for the staff or the hospital.
It's a wonderful opportunity, absolutely. It's that ground level where we, the foundation, can come to work and think about something else other than having to have that struggle. So yeah, we're very grateful that you made that decision. The foundation has a really great relationship with the health service. Why do you think it's so important that we work so closely together to support our community?
Well, look, I think the foundation is absolutely essential for the health service for a number of reasons. That the health service is a state government operation, it's publicly funded, and there's lots of rules and regulations as what you can do with money and so on. Just the little things, you know, we can't go and spend money on presents for staff and that sort of thing. So the things that you would like to do for staff that have worked for a long time, they might have had a sadness in their family or they may have had some success, where the foundation's able to step in and provide that human touch of putting on a little function, giving a bunch of flowers or a gift or that sort of thing. That's enormous help. We've got 6,500 staff, and for our staff to feel appreciated is really important. And health is so busy, it's 24 hours a day, 365 days of the year. There's very little time for staff to stop for those nice things. And I've always felt that that's been one of the really, really important things that the foundation has done. But then they've done far more than that. They've provided us with equipment when we haven't had the funds to do it. So our budgeted funds are limited, and you know, we can't run at a loss every year. We have to balance the books. And so when we've been short of funds and staff have needed equipment, and it might be in some cardiac equipment or other sorts of things, the foundation has stepped in. But there have also been other things that they've done, in particular taking over the Red Cross building and providing on-site accommodation for rural families that are coming to stay and be near their loved ones while they receive treatment. That's a fantastic service, a very, very helpful service, more people orientated rather than equipment orientated. And then recently the foundation helped us out at Millmerran, where the GP service was no longer there in the town, and the foundation was able to buy up the building, renovate it, and we lease it back from the foundation. And as a consequence, we've been able to attract 3 very good doctors, a lady doctor and a young doctor who's got 4 kids, to the town, and they provide a combined service to the Millmerran Hospital and to the GP practice in the middle of the town in the facility that the foundation provided. So that's been a branching out from just providing things in Toowoomba, as the foundation has started to spread its wings and provide assistance in our other rural hospitals.
And it's lovely to be able to support families to actually stay close to home. I think that's one of the most rewarding things, is to be able to say that we're purchasing equipment that provides a service that they'd otherwise have to, you know, go to Brisbane or other areas. It's so lovely, and then having that accommodation to mean that they can stay on site and be close to when babies are born. And yeah, it's very rewarding and lovely to think that our community can keep their people local and not have to travel for.
We do a lot of engagement with our communities. Every second board meeting we go out to a rural area and we have lunch with invited people from the community. And that's the overwhelming thing that everybody wants, that they want to have as many services as possible near their home. Yeah. And you can understand that, you know, if you're a young family and you've got kids and you're on a property and a kid comes off the motorbike and you want to be able to race straight into town, and town might be an hour away, and get the immediate treatment for your child. As much as possible, people like to birth as close to home as they can. We've got 7 birthing centres. That's always a challenge these days, but that's very important to people, and sometimes to have accommodation near a birthing centre where families can move, stay there while they wait the birth of their child. And then in the issue of nursing homes, it's important. Like, people might be well in their 90s, but they want to stay in Toowoomba or Stanthorpe or Wandai. They don't want to have to go way away from where they've lived and run their businesses and sort of thing. So the involvement of a local board in a community, but having the foundation able to help us in so many ways is just terrific. And I think the foundation's got a great name throughout the area. Certainly it's very famous for some of the events it puts on, but all those events are quality events. They raise good money, and the money goes straight back into our town. And you know, I think the foundation does a good job in letting the public know what it's spending the money on, and that's important.
Very
so
important.
Donors and people who buy raffle tickets or whatever they buy, they know that the money's going to things in their own area.
Absolutely. The health service has got some very exciting projects in the pipeline, notably the new Toowoomba Hospital. What can our community expect to see over the next couple of years?
Well, I think the community is going to see one of the most exciting times ever for health in Toowoomba, or perhaps in one of Australia's regional cities. Toowoomba is already known as the capital of agriculture for Australia. It's probably one of the capital education centres for regional Australia, but it's about to become one of the major health centres of regional Australia. As you mentioned, Alison, we've got $1.3 billion, got to change over from millions to billions, $1.3 billion new hospital which has commenced construction at the Bailey Henderson site, which is 185 acres, a beautiful site. As well as that, on that same site, we're well underway with a $42 million day surgery on the site, and we have plans in the future, which I know the Foundation is keen to help us with, for a regional cancer centre in one of the lovely buildings there that has a holistic outlook across the valley to the north. We're also establishing there a teaching, learning and research centre, so the medical school that we're establishing with 3 other partners commences next year, and that'll be fully up and running in 4 years' time with the 4 years of course. And on that site there'll be in the future probably a high-rise hotel, a daycare centre, a little shopping village, and maybe more accommodation for rural people. But excitingly also, we're retaining the old site, and in 5 years' time the old site will provide 9 to 5 services like dental and specialist outpatients and some other services. But we have visions for that site that it could be some sort of clinical institute where again we might have teaching and learning. We could do more day surgery there. But we would like to look at companies like Telstra Health. We would like to look at the Queensland Institute of Medical Research, CSL, maybe the Walter and Eliza Hall Foundation in Melbourne. But we would like to see Toowoomba host in that CBD site there a clinical institute of some sort that not only provides clinical care to people, but also has research and provides study and other opportunities for people. And when you combine that with our wonderful private hospitals in St Vincent's and St Andrews, and the new Toowoomba Hospital and all the various GP and specialist facilities in the town, and the fact that we've got an international airport on our western boundary, I think it will set Toowoomba up to be a very, very important health centre as well as education and agriculture.
A great place to live.
It will be a great place to live, and there'll always be a role for the Foundation all through that in helping us. I know the Foundation's interested in helping us with our regional cancer centre, but there'll be other things that we'll have to do. There'll be accommodation needed on the Bailey Henderson site for staff and for families. The Foundation, I know, is going to establish a museum on that site. Now that museum takes 2 collections, one from the old hospital on the CBD site and one from the Bailey Henderson site, and puts the 2 of them together. 2 valuable collections, but puts them in a modern redeveloped building, and again that'll be another attraction in Toowoomba. People can come up to Toowoomba and go to do a museum trail, go to Cobb & Co and go to the Health Museum. What a day out.
It will be very exciting. The collection is, it's extraordinary. There's some pretty creative pieces there, so we're looking forward to opening the doors in December, which is only not long away.
This year.
Our donors and community give us they give so generously to us. What is the greatest impact these donations have had for patients and staff of the health service? It's a big question.
Yeah, but the greatest impact is probably the equipment that is provided, and also the support for our staff. Now, our staff work incredibly hard, and at times, and most times, they can be under enormous stress in their job. If you just look at our emergency department, around about 200 patients a day come in there. Now, many of those patients are coming in clinging to life. It's stressful, it's urgent, it's got to be highly professional, it's got to be humanitarian at the same time. And for those sort of staff to know that they've always got the backup of the Hospital Foundation that'll put on a little afternoon tea for them, or just all those little sorts of things that make them feel that they're well regarded for the work they do. So that has been an enormous help, I think, to our staff. It gives another meaning to working for the Darling Downs Hospital and Health Service, or working in the Toowoomba Hospital, or the Dalby, or Warwick, or Stanthorpe Hospital, Kingaroy, and so on. Then the equipment that's been provided has been terrific. And, you know, for a number of our dedicated doctors and nurses, oftentimes they just can't get the equipment they want because our budget limit has been reached. And to be able to get some specialised piece of equipment that enables them to provide even better care and better diagnosis is a great boost to our staff. And, you know, for our staff, they've got to have real satisfaction in the hard work that they do. They know that they've got the support of the board and the executive and the hospital foundation, and through the foundation, the community, and understand that the people who live in our area really appreciate what they do. And I think the foundation plays a big role in that.
Wonderful. Tell us what you enjoy the most about being on the foundation and health service boards.
Well, I'm actually in awe of our staff. I remember once when I was Minister for Health, I visited a maternity unit at the Royal Brisbane Hospital, and I remember seeing a premature baby that was about the size of a small piece of butter almost, in a little glass case with numerous tubes into the baby's nose and tummy and elsewhere, and one nurse sitting with it, and the nurses did 4-hour shifts with this baby 24 hours a day. It was premature and it had a major operation on its heart. It was at Prince Charles Hospital actually. And every so often, with the little baby was sort of heaving away, it would stop breathing, and the nurse would put a hand in through a hole in the thing with a finger and resuscitate the chest, say, come on darling, come on. And I never forgot that. And I thought to myself, what a responsibility, you know, to sit there for 4 hours at a time, and that little life was in her hands. Now that little life now is probably a 28-year-old woman, you know, and so that really, it really struck me about the responsibility that people have. And sometimes it's not quite as spectacular, if you like, as that. Sometimes it's just fluffing up the pillow behind an old lady in a nursing home and making her feel more comfortable. So I used to say to the staff that when you walk away at the end of the day, always remember that you've made someone more comfortable. And that, I think that what our staff do is just incredible. And for me, that's been the greatest honour in being chairman of the board and being on the hospital, the health board and the foundation board, is to be able to help our staff. I think the other thing that is involved is it's very much for our community. So whatever we do in the foundation, or whatever we do in the hospital and health board, it's to build a better hospital, it's to attract more staff, it's to provide training for our staff, it's providing research opportunities, it's to make the care better. I mean, some of the things that have been most appreciated in country hospitals has been taking chemotherapy from where it was at the Toowoomba Hospital, and also having it at Dalby and at Kingaroy and at Warwick. And people just appreciate it, so that people who've got cancer don't have to travel that extra hour and a half or so. They can get that treatment. And the same with renal dialysis. You know. So to be able to provide those things, and in the rural areas, the appreciation is immense. I remember when we put chemotherapy services out at Dalby, the Mayor, Paul McVeigh, rang me up. He said, "Oh, thank you so much." And that's when I came to realise what it means to a community to get some of those services out there. And so that's not just the Hospital and Health Board and our executive that do that, but it's a combination with our partners, the Hospital Foundation. And very often, sometimes the Hospital Foundation does the curtains and the furniture and makes the place nice, and that makes it even better.
Well, it's been an absolute pleasure chatting to you today. You always have a wealth of knowledge and so many stories. You know, the years that you've contributed to the community is extensive, and we really thank you for sharing your time today, and we really love working with you, and we just wanted to say thanks for coming in today and having a chat. So yeah. Thanks for being here.
Thanks, Alison. Thanks for what you and the foundation do. We couldn't do it without you.
Thank you.